primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever so relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care allows me to give patients access to highest quality care that they deserve and also gives my life back. I'm Dr. Melissa Ratliff with Ratliff Integrative Medicine, and this is my DPC story.
Dr. Melissa Ratliff is a family physician and native of Charlotte, North Carolina. She spent her career caring for the people who make up the city she loves. After graduating from West Charlotte High School, she attended Davidson College, where she was a pre-med student and majored in chemistry. It's also where she met Stephen, the love of her life. They got married shortly after college, after which they had their two boys, Jacob and Benjamin, who are now adults and living in Asheville and Raleigh, North Carolina, respectively. She went to Eastern Virginia Medical School in Norfolk, Virginia, then returned to Charlotte for her family medicine residency at Atrium Health, then Carolinas Medical Center. She served as a family physician at Novant Health Blakeney Family Physicians for 9 years, during which time she was lead physician for a team of 9 healthcare providers. Prior to starting her own practice, she was a concierge family physician at Welcome MD, helping her patients reach their health goals instead of just treating symptoms and sending them on their way. She earned both her Certified Physician Executive or CPE certificate from the American Association of Physician Leadership or AAPL and completed her fellowship in Integrative Medicine at the University of Arizona Andrew Weil Center for Integrative Medicine in Tucson, Arizona in 2023. Welcome to the podcast, Dr. Ratliff.
Thank you. Glad to be here.
One of the most fascinating things that I love is people's journeys into DPC. I mean, clearly anyone who's listened to the podcast knows that. But for you, it was very interesting for me to learn about your post-baccalaureate journey. I was a post-bac person myself. I did a post-bac year between undergrad and medical school, and you had done different post-bac years. And so in your journey, can you tell us about how you went from undergrad into post-bac? And within that journey, did you know that you were eventually going to become a physician?
Yes, very much so. Yes. So I was a chemistry and pre-med major in college and was always planning on going to medical school until I fell in love. And then at that point, it was on. So I was like, how can I be the wife and mother that I want to be and be a physician? The female physicians that I knew didn't have much of a life at that time. This was in the early 90s, and I was scared. So I chickened out. I decided not to take the MCAT that year and decided not to apply to medical school and decided to get married. So I got married in June, right after graduation in May, and moved to Atlanta, Georgia with my husband, where he was in seminary. And then I was questioning, well, what do I do next? What am I going to do if not medicine? So I began working as a chemist, doing soil and water testing in an environmental lab, and quickly found out that that wasn't for me. The bench work, chemistry, being under a vent hood all day just was not working. I was too social. I lacked that interaction with people. So I decided to kind of think about what I wanted to do. So I attended a career planning session at the seminary where my husband was studying. And they were used to having seminary students go through their process. And so here there was this scientist person coming through, and they were like, I don't know what to do with you really, but everything's showing that you're supposed to be a doctor. And I was like, no, but I can't. I can't be a doctor right now. It's not in the cards. It's not going to work for me. So I kept pushing that back in the back of my head. And decided, well, I got to find something else I can do. If it's not going to be chemistry, not going to be medicine, what am I going to do? So I took another course. I took a course at the seminary and thought, well, maybe seminary. Who knows? Not so much. And then after my husband graduated, we moved to a small town in North Carolina where he had two churches. And I decided I wasn't going to work. I was going to take some time for discernment, just to really figure out what I wanted to do with the rest of my life. And I started taking a couple of classes. I was commuting 1 to 2 hours to either UNC Charlotte or UNC Greensboro to take classes. And primarily they were in the psychological sciences because I was thinking maybe PhD in clinical psychology. And I did that up until I delivered my first child. And then started thinking, well, now what? I have a child and I'm going to apply to grad school. So I did. I took the GRE, took the psych GRE, and I was hoping to get in at Wake Forest, but it wasn't in the cards. And I think maybe that was kind of a blessing in disguise. Who knows why things happen the way they do, but I continued taking classes, and my husband decided that it was time for a move to a different church. So we moved to Norfolk, Virginia. And while we were there, I became kind of antsy. We had our second child, and I was a stay-at-home mom and really antsy. Love my kids to death, but I was really craving some more intellectual stimulation. So I took another couple of classes while we were there, and I talked with my family medicine physician at one of my appointments, and she said, Melissa, seriously, go to med school. Just at least look at it, consider it. Well, here I was almost 10, 11 years out from undergrad. How in the world was I going to go back to med school? That meant taking the MCAT and all of that. Well, I started looking into it. And sure enough, my credits were going to count, would still count. So I was fortunate in that respect. And I took the MCAT and eventually got into med school there in Norfolk, right around the corner from my house. So that just played out perfectly. But those post-baccalaureate classes really prepared me for med school, even though a lot of them were in the psychological sciences. It was an important part of my career path.
That's so wonderful. And I think about, I don't know if the listeners also have that experience, but there were people in my class at Creighton who had careers completely like solid careers for like a decade or more in some cases, before they went to Creighton and became doctors. And so I just put that out there because when you talk about it being in the cards, I think there's also a part in, like you were sharing too, what do you want out of life? And if the cards are in your favor, great. But if they're not in your favor today, they might be there tomorrow. So just
Right.
a little bit of hope and inspiration for people who are like, I'm in a career, I can't do it, but I would like to. So I think that your journey is so inspiring.
Thank
So
you.
let me ask you there, when you decided, and I think it's so cool that your medical school was around the corner from where you were actually living. You didn't have to get uprooted and move to a different state. But how did you handle being a mom? Because how old were your kids at that time? Were they in school? Especially the first 2 years of med school are so demanding when it comes to like, you have to be in lecture. So I want to ask you about how you handled being a mom while being a med student, especially in those first 2 years.
Yeah. So when I started med school, I had a 3-year-old and an 8-year-old. So they were both boys, so lots of energy, of course. And they were involved in so many things. So, yeah, I would attend scout meetings and choir practice and soccer games, soccer practice, usually with a book in my hand. And they knew that. I would take time every day when I got home after classwork to spend time with them for an hour or two in the evening. And then, of course, I would go back into the bedroom and do my little studying. But it worked. It worked. And when I look back on that now, I'm really thankful that I gave my kids that opportunity to see that it was a good thing to go after your dreams and that it's hard work, but it's worth it.
Amazing. And we'll talk about one of your sons especially later, but I'm sure that your journey in becoming a physician and what your kids saw absolutely impacted their entrepreneurial spirit in the future. So, in their futures. So, let me ask you there, as you were going through medical school, you would talk to your family physician in Virginia. She was like, "Come on now. You can do this too. You can be a doctor." Was it in any what like, did that conversation impact you at all in terms of choosing family medicine as a specialty? Or how did you eventually realize, like, family medicine's for me?
So I was between pediatrics probably and family medicine. So when I was a young child, my pediatrician was very important to me. And so that's sort of where I got the thoughts of being a doctor one day anyway. So pediatrics was high on the list. And then, of course, my family doctor at that time, Dr. Sinclair McCracken in Norfolk, was really instrumental but it wasn't until I really got into my rotations and started figuring out what I liked, what I didn't like. And my first rotation was surgery. And I was like, no way, this isn't for me. But everything else I liked. And I realized family medicine gives me that opportunity to do a little bit of everything, some peds, some gynecology, a little bit of everything.
Gotcha. Now, when you realized, and I will have to say here that, like, that is, I feel, such a common journey in terms of peds or family, because you get to deal with families in both, but I totally was in the same boat when I was deciding peds or family, and same thing, chose family. So let me ask you now, after you finished residency, in your first practice, you were a physician who was not only practicing herself, but was also in charge of a team of 9 people. So let me ask you about that before we start talking about your DPC journey. Because when people are in fee for service, especially in their first 1 to 3 years out of residency, a lot of people are they have their panel, they see their panel, they have an MA, front office desk, whatever. But it's pretty unique that you were in charge of 9 healthcare providers. So tell us about that experience.
Yeah. So I think probably a lot of that stemmed from my maturity at that stage in life. When I joined the practice as a newbie, I was I was sort of already put ahead of people who had seniority because of my age, my life experience. And whether it was fair or not to the ones that had seniority, leadership kind of selected me to help lead the clinic, and I took it on. I loved it. I loved building teams, creating workflows. I loved educating physicians on best practices. I really got into it and thought that, yeah, I may work my way up the administrative ladder, and really started pursuing more leadership training. So I did my certification as a physician executive through the American Association of Physician Leaders. And I thought this was my path until I started running into roadblocks. When I would suggest things, no, 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 there's no money. No, we can't do that. No, stroke and cardiovascular have priority, things like that. And I was like, this isn't working.
And because you were with a team of 9 people, can you share who those people were? What roles were they? Were they fellow physicians? Were they also support staff? Who was on your team of 9?
Yeah, so we had two PAs and then seven physicians, and we had a staff of 40 employees.
And this is at a single location?
Yes, in South Charlotte.
Gotcha, gotcha. And
Yeah.
when you were facing these roadblocks, and you were trying to do your best, incorporating all of the lessons you had learned by getting your certificate of leadership, and you're bringing to the table your expertise as a physician as well as your life experience. How did you cope with that, and what eventually made you decide to leave that role?
I think I just sort of felt like it wasn't sustainable for me to continue this. I was exhausted, and I felt like I was putting all my energy and my passion into something that wasn't moving anywhere.
And do you feel that because of the life experience you had lived, if you'd had 2 kids, you've moved around different states, do you think that you got to this place of like, I am recognizing that this is not going to be fulfilling my life in the way I need it to sooner than if you had not had those same experiences?
Probably so. Yeah. Yeah.
And then what did you end up doing after you left that position?
So interesting story there. So I left that practice in July of 2021. And in January of that year, I started my new discernment process on what I was going to do next. So over that 6 to 7 month period, I was trying to figure out what my next step was. I knew that since residency, I wanted to do the integrative medicine fellowship. So that was one priority for me on how I could do that next. And then my other priority was wanting to do direct primary care. So I was figuring out at that time how I could do that. I knew that if I wanted to do the integrative medicine fellowship, it was going to take a large chunk of my time and that I couldn't spend my evenings charting and studying. So I had to be able to have a position where I could study in the evenings that I would have more free time. So I looked into direct primary care and the concierge practice. So my fear, though, was financial in making the DPC leap. So my husband and I talked about it and we tried to figure out how we could make this work. It scared him to death because of the two of us. I was the breadwinner. He is a Presbyterian minister and works part-time. So we were dependent on my income and having a child in college and still paying med school loans. So financial aspects were a large part of that. So we sort of decided, well, the next best thing to DPC is doing the concierge practice until I'm able to do my own direct primary care. So we started at that time planning how we were going to map this out over the next 2 years. And it did. It took a little over 2 years till I got to the point of opening my practice. I decided that I was going to do concierge for a while and do the fellowship together. So August 1st of 2021, I started both a new job and the integrative medicine fellowship.
And how did that work out? Because with the concierge practice being different than the role you were previously in, were you in charge of multiple people at the time, or did you have the time to finish your notes during work hours and then also have the time to be able to do your studies for the integrative fellowship?
Yes, I had plenty of time to get my notes done. I was not inheriting a patient panel from anyone, so I was building it as I went. So I started with 0 patients coming in the door. So it did take a while to build up. So yeah, I had plenty of time to sit and study and at my desk in my office while I was building my practice. So it worked out well.
And because that journey started in 2021 and we're recording this in 2024, what was it that was the difference between what made the difference between, hey, like I know I was thinking about DPC, but I could just stay in concierge rather than opening my own clinic?
So, so I really enjoyed being able to develop relationships, have longer appointment times with my patients. And since I had such a small panel and growing slowly, I really could invest myself with them and learn more about them at deeper levels. Interestingly, I had patients follow me from my previous practice to the concierge practice. And spending time with them at an hour appointment, I learned things about them that over the previous 9 years I never knew because I didn't have time any longer than 15 minutes with them at a time. So it was very refreshing to be able to develop those relationships, but at the same time, some of the some of the aspects of concierge didn't appeal to me. Yeah.
I definitely would say if people are interested in this difference between concierge medicine and DPC and people who've chosen to, like yourself, to go from concierge to DPC, another doctor I would definitely recommend listening to on this podcast was Dr. Ingrid Liu out of the Chicagoland area, who was in different concierge practices prior to opening her own DPC. So definitely, I love asking this question because in terms of the differences between concierge medicine and DPC, I cannot illustrate that there is definitely a difference, especially when there's people like yourself and Dr. Liu who have chosen to not remain in concierge medicine because they are totally different ways of practicing medicine. Even though our patients get concierge-like level care, we are not concierge medicine in direct primary care. So love that. I'm hoping that that helps make that distinction very black and white for people who are listening. So when you were like, hey, I'm in my fellowship, I have this concierge practice, how did you then decide to make that cut and say the one door has closed on concierge medicine and now I want to open my own practice?
Yeah, so as I was referring to earlier, it was a lot of the financial stuff, being sure that we had things in place. So we saved up at that point enough to finish paying off my kids' college. So that was an important part. We paid off the cars. We made sure we had things in place before I went from salary, a paycheck, to nothing, because that was a huge fear. But it did. It took some planning there.
And a fear that many of us have. Like I opened with 0 patients, and the people who've come onto this podcast, I would say for the most part, people had 0 patients. There's been people who have opened in areas where they had not practiced before. And so for you, still remaining in the Charlotte-esque area, you're 30 minutes outside of Charlotte. How did you decide that this was where you were going to practice? Did that have anything to do with where you were living or where your husband was ministering?
So because I have a non-compete, I had to go 10 miles out from my previous practice. So that was one factor. It happened to also kind of intersect with my previous practice before the concierge. So I had a cluster of patients actually from Waxhaw that I used to see. So that was a good kind of mix, but it's also in the county where my husband's church is now. So there were lots of different things in the decision on where to draw that little radius of 10 miles out from my practice at that time.
I think about people like Dr. Krista Springston who are like, I think 0.1 miles outside of the non-compete radius.
Yes.
So
Yeah.
more power to you. Love this. Now, when you decided like, hey, geographically, this would work, and you opened in Waxhaw, can you tell us a little bit about the community, how it's different than the demographics of your previous practices? Because you had some patients already coming from Waxhaw, like you mentioned, but like in terms of the access to medical care, the types of medical practices, the type of income, insurance level, tell us about Waxhaw in particular.
Yeah, so Waxhaw is sort of a bedroom community to Charlotte. It typically, well, it previously was a very rural area. People that lived there their whole lives didn't leave the county, always lived there. But as Charlotte grew and expanded, more and more people moved out further out from the city. So they would either commute back into Charlotte to work and then wanted to live in a nice community the rest of their time, right? So Waxhaw has sort of become this equestrian community. So there are lots of horse farms here, lots of very affluent families in the area, as well as lots of communities, small neighborhoods of communities that have had generations of family here that live on like farms and still working farms. So quite a diverse population in the area now. So average income, I think I saw that you had written down 120,000. I was actually kind of surprised at that. I would have guessed it was higher in the area.
When I saw that amount, that was from, I believe, the 2018 census, but it's definitely something that, if you're wanting to know that data for your practice, and this is going out to the listeners, if there's DPCs in all 50 states. So you can also, ask people who have other physicians who've opened, did you find this information? Where did you find it, to see if there's more up-to-date data for your area? So that said, what about the healthcare access? Is there a rural access hospital in Waxhaw, or what is the access to healthcare like for the people who live there?
So there are two large healthcare systems in the Charlotte area, and each of those have a clinic in the Waxhaw area. there is an emergency room, a standalone emergency room by one of those healthcare systems in Waxhaw. But otherwise, there are really little to no independent physicians in the area. So with me being here, it's very opening and encouraging to those who want to escape those large healthcare systems.
Absolutely. And I love that not only were you able to be a beacon of change and personalized healthcare, but also you have your fellowship under your belt by the time that you opened, which is amazing. So let me ask you now, when you were looking at Waxhaw, was it fairly easy to find a space?
So I worked with a realtor to help me find a location. And what I was looking for was something small because I wanted to have low overhead and also wanted kind of an intimate setting where it felt like a comfortable, welcome place. So I found a location in a counseling office. So it's an office that has 5 offices individually rented out to different counselors. And so I'm the only MD in here, but it works out great because it's quiet environment. There are sofas and chairs and it's a comfy environment. There's an entry waiting area up front that's secured. There's like a two-way mirror because it is a counseling office. But I feel very safe and comfortable in this office park. In the office park, there are other practitioners of like chiropractic, there's an oral surgeon, there's I think some other different practitioners like massage therapy, physical therapy, speech therapy. There aren't any other physicians though here.
I think that it also speaks to something that previous guests have shared about is that you're in an area where people expect to find healthcare. Like Dr. Erica Young shared about this in the area of Georgia where she's practicing. What about if other people are looking for professional park areas or areas, even if it's a strip mall where there are other practitioners of different healthcare professions, do you have any tips as to how to evaluate the real estate, as well as are there any pitfalls or cons or places to be wary of or things to be wary of for those people who are looking at similar situations?
Yeah, so one thing that was important to me is that I wanted a 1-year lease, and some people were wanting 3 and 5 years. And I really wanted to have that flexibility because I didn't know how fast I was going to grow. If after a year I wanted a larger space, I was going to need to move, and I didn't want to be locked into a lease that I didn't need. And I also wanted to be sure that I could work with the people I was renting from. So I connected with the people here at the office when I first visited and toured, and I was like, I felt comfortable. That was an important part to me because relationships are important, and I wanted to have that in place too.
Amen to that. I'm like clapping over here because the shortest lease that you can get in is great. And Dr. John Jacobson shared on his podcast about this thing exactly. It's like he said, why buy what you can rent? Why rent what you can steal? And he has not gotten to the point of stealing, but at the same time, when you're thinking about overhead being low, you do not know what the adoption of DPC is going to be like in your community, especially when you're really the only independent doctor in the area and you're doing DPC. I think that definitely allows you to have that flexibility without the long-term time investment, if that is possible. So love that. Now, how about the space in terms of how your space is situated in terms of number of patients that you can see per day and thinking about the growth of your practice? I want to ask this because a lot of people that have shared that they've opened with single space, they're renting a space or they're subleasing a space. Have you envisioned at what breaking point, so to speak, your practice would be needing to transition to a larger space?
Yeah, so my space is an 11 by 11 office, and you can see here my exam table is right there, my scale. This is pretty much it, and it's just me right now. And as I grow, I anticipate needing a staff person. So if that's an in-person staff person, I would definitely need to have a larger space. Right now, I'm considering virtual. Like, at what point do I do I look at that? But also at some point, I would like to have a lab or at least be able to draw blood in my office. Right now, I'm kind of limited and I don't have space to do it. So I send patients to LabCorp.
Now, let's talk about the growth of your practice because you said you started out new community for you in terms of your patients were from Waxhaw before, some of them, but you had not practiced in Waxhaw before. How was your opening day? Did you already have patients who were like, "When are you opening? Because I'm going to join your practice on that day."
Yes, of course. Even despite having a non-compete, people were tracking me down. The internet's a wonderful tool in this world. So yes, the day after I left the previous practice, I did like my media burst to announce where I was going to be. And immediately I had patients reaching out. So on the first day, I think I had probably, and I should have looked this up to quote exactly, but I think I had 20 people signed up. So that was a good starting point. And I had a really warm reception to the community. Waxhaw Business Association did a ribbon cutting for me, and the mayor came. I had a group of other people in the community showed up. So it was a really warm welcome to the community.
20 patients. Congratulations. I mean, I know it's a belated, but that's amazing. I love that. And I hope it gives people hope in terms of people are also facing non-competes. So I think that's wonderful. So with 20 patients already ready to join you, and granted you knew something about these people before because they were following you, but how did you handle the onboarding of 20 people? Because even one person can be quite a lot when you're opening your own practice. How did you handle 20 without staff?
Right. So I did it very slowly, kind of staggered. Fortunately, I have access to the portals to both the two large healthcare systems. So I was able to pull a lot of data, especially from the practice where I was previously that was in the large healthcare system. I could see all my old notes. So I was able to pull stuff in, and that was a big part of it. What took the most time was just sitting down with each individual patient for an hour because my appointments are so long and I want to know so much about them. And it took time. So yeah, I was staggering my schedule so that I could fit people in. And they were all very understanding. I mean, these were people who some of them I've been seeing since I started out of residency. So people that were very committed and wanted to make this happen. So they're like, "Oh, no problem. I'll see you when you got time for me." They were very understanding.
So rewarding, especially as a family doctor or just somebody in primary care who that generational aspect to care, the longevity of of a relationship really that hones in on how valuable that is. So with that, and I mentioned earlier, we talk about your sons and the impact of your entrepreneurial journey on their journeys in life, but your son, Jacob, has helped you with marketing of your practice. So what did that look like? And at what point did you say, "Hey, you're an expert in something that I need help with"?
Yes. So it was Thanksgiving of 2020. Oh my goodness, it's all running together. 2022, Thanksgiving of 2022. We were sitting around, I think after eating all the turkey and we're tired and everything. And all of a sudden Jacob pops up and says, "So mom, you going to do this thing?" And he is all in. So he jumps on his laptop, creates a spreadsheet, creates an agenda of a plan, and is all in gung ho because his business is in digital marketing, doing counseling and consulting for small businesses. He's based in Asheville, but he has had clients all over the country now who sort of found him as a especially as an LGBTQ friendly counselor, coach. Yeah.
That's awesome. And I just love also that as we have heard on the podcast, people call their DPCs their next child after having human children. I love that one of your human children is helping you with your non-human child growing and developing. So let me ask you, with his expertise and his spreadsheets and the checklists of like what you guys were going to do, how did he use his skills to interpret what direct primary care is to an area that wasn't familiar with direct primary care?
Yeah, so there was a lot of learning, and between the two of us, we sort of tried to figure out how to approach things. We took many steps. We would do Zoom calls just about every week before I even turned in my notice that I was leaving. So this was a very organized, methodical process for him, because that's the way he worked with his clients. And I was very appreciative of that. And we were very careful not to step on each other's toes, because it's really hard when your family members working together and on something like this. And I totally respect his knowledge and his vision for how to build a small business. My father is also an entrepreneur, and so but between among the three of us, it's sort of ingrained on how to build a small business, but it also takes a lot of work. And Jacob was really helpful for me in doing that. He created my website. I wrote the text, but he certainly helped edit it and organize it so that it was very presentable. I was very pleased with how it turned out.
Kudos to him. I definitely will say it's very clean and it's very, I can easily see how somebody looking on your website is like, that's me. Like I want that care. And there's a button for every section of your website, like men's health, integrative health therapies. Like if there's your services are broken down so that they're pertinent to the avatars who are going to be your future members. So I really give him kudos for that. Now, what about in terms of marketing your practice? You have also been present on Natural Awakenings. So, can you tell the audience what is Natural Awakenings and how has that helped your practice and its growth?
Yeah. So Natural Awakenings is a health and fitness magazine that primarily has advertisers of more of the integrative space. So lots of like massage therapists will use that magazine, for example, to help promote their practices. But it also includes lots of articles on health and wellness techniques, what's the newest trends, things like that. And so I used their magazine to help at least give me an advertising space. So that was the only magazine that I chose to advertise in here locally. There is a Charlotte edition. I think there are probably editions all over the country, but with the Charlotte edition, I think it was distributed around 3 to 4 counties in the area. So a large space, and it's usually like in doctor's offices or the massage therapist office, whatever. And with signing up with them, it also gave me access to writing blog posts. So I did that with them. And then there were a couple other articles that they featured me as an integrated physician in the area.
And you can definitely check those out. I'll put them on your blog, but the article you did about menopause, I mean, there's definitely people in no matter what community you live in who are going to be interested in menopause. So I think that's wonderful that you had a platform where people were interested in health, where you're also able to talk about integrative medicine and you as a physician. So with that, in January of 2024, you had started some Zoom calls. Great way to kickstart the year, but can you tell us about how you created this plan of even doing the Zoom calls in addition to your presence on Natural Awakenings, and how did those Zoom calls help your practice and help people to understand what you were doing for the community?
Yeah. So the ad in Natural Awakenings mentioned that I was going to be doing these webinars for the month of January, and I called them Healthier You in 2024. And it was a series of 5 weeks because there were 5 Tuesdays in the month. So each Tuesday evening for an hour, I would spend time with a group of people, whoever chose to join, to talk about diet and exercise and sleep, stress reduction, and building resiliency. And it ended up being a really good small group of people that stuck through and actually attended each of the sessions for 5 weeks. So it was a real opportunity to kind of have a version of group visits in a way that it was comfortable for people in their homes.
Amazing. And I'm sure, especially being in January when you started that, when you started that, I'm sure that you got different buy-in than if you had started in June. One of the things that I love looking at is people's logos. So I actually don't know the answer to this. It looks like there's a bee in the middle of your logo and it's a circular logo. And I was trying to put are those echinacea flowers? I couldn't,
Exactly.
okay. Awesome. Awesome. I'm like, I was like, I think those are, but I'll ask you. So that's awesome. So tell us about your logo and how you got your logo to represent what you're doing for your community and your practice.
Yeah. So my name, Melissa, means honeybee. So that's sort of always been something that I liked as a symbol for me. So that I knew going in that that was one thing I wanted. But I met with a graphic artist who spent 2 hours with me wanting to get to know me. I mean, she asked me some deep questions, and we kind of worked through what values do I want to portray? What's important to me? And we talked about how relationships and lifetime learning, being involved in education and being an advocate for patients, and how courage is important to me, and that also I really like being creative. I want to show my creative side. So we came up with, well, mostly she did after I talked with her, but she designed the logo that includes a honeybee at the center. And that kind of symbolizes a lot of different things. So yeah, it happened to be related to my name, but also honey is so important in the integrative world. It's wonderful healing powers. And it also is an important part in nature. And there are so many things. We wouldn't have all these beautiful flowers and everything in nature without these little pollinators working like crazy. So the honeybee is a very important part. And the design also includes the echinacea flowers over to the sides of the bee, which is also used a lot in as an herbal to help with allergies, asthma, those kinds of things. But it also is a symbol of health and healing. And that was very important. The round circle is important in that it is a symbol of building relationships and being connected with one another. So that's kind of how that sort of was created.
So beautiful, and definitely check out Dr. Ratliff's logo. It is definitely, when you see it, you can hear her voice saying these things about how it represents the person she is. So it's amazing. So let me ask you now, going into the future, you are in your first year of doing DPC, owning your own practice, making it what you want it to be. What do you see in the future, in the next 3, 5 years of your practice? Because I love asking this, because in 3 and 5 years, you're gonna look back and say like, wow, my journey, like I nailed it, or it's totally gone a different direction.
Yeah, so I really want to build more on the prevention part of my practice. I am still primary care, so yes, I still manage patients with diabetes, heart disease, hypertension, all of those things. But I really want to invest in the community as doing preventive care, true preventive care, where we're preventing all of those diseases. So I like to talk with my patients about diet and exercise and sleep and stress reduction, building resiliency, social connections, mood, spirituality, all of those different things. And I really would like to be known in the community as someone who's really helping to knock out diseases, because we're addressing all of these things when people are young.
Amazing. Thank you so much, Dr. Ratliff, for joining us today and sharing your story.
Thanks for being here.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.